All right, ready to jump in. Today we're tackling a really cool corner of healthcare anesthetic technicians.
Definitely a hot topic, and for good reason.
Yeah, you sent over some stuff from RoleCatcher, and I gotta say, even I learned a lot. It's way more than just, handing instruments to the surgeon.
Absolutely. It's a whole hidden world in healthcare. Vital, but behind the scenes.
So let's say, just imagine, you're just starting out, right? Fresh out of school, first job as an anesthetic technician.
Huge learning curve, but so rewarding.
What's that actually look like day to day? Like, walk me through it.
Okay, so picture this. You're Sarah, brand new anesthetic technician. Your day starts way before the first patient. You're prepping the OR, making sure every single piece of equipment is spotless, in perfect working order.
Wow, yeah, that's a lot of responsibility. What kind of equipment are we even talking about?
Everything. Anesthesia machines, patient monitors, airway equipment, you name it. It's like a high-stakes orchestra. Each instrument has to be perfectly tuned.
And you're the conductor, basically.
Exactly. And then on top of that, you're also working towards those crucial certifications.
Right, like the CAT?
Yep, the Certified Anesthetic Technician. That's your bread and butter.
Yeah.
Shows you've got the knowledge, the skills, the whole shebang.
Okay, so that's the big one. What about like ALS and BLS? Those come up a lot too.
100%. You absolutely need those. Advanced life support, basic life support, got to be ready for anything. Emergencies happen, and when they do, you're the one who needs to keep a cool head.
Talk about pressure. So you're not just a tech whiz. You've got to be calm under fire. Think on your feet. And then on top of all that, you're also dealing with like the human side of things.
Oh, absolutely. We haven't even touched on that yet, but it's huge.
Right. You're interacting with patients often on one of the most stressful days of their lives. I mean, how do you even begin to do that? What do you say to someone right before they go under?
It's tough, right? You got to find that balance, Like you're there to reassure them, but also you can't sugarcoat it. It's surgery.
Yeah, no kidding. So you're like a tech expert, a mind reader, Andy, a therapist, all rolled into one.
Pretty much. And as you get more experience under your belt, you might find yourself, drawn to certain types of cases, certain specialities.
Oh, yeah. Like within the anesthetic technician world, there's even more specific niches.
Totally. Some people, they love working with kids, so pediatric anesthesia is their jam. Others, they're fascinated by the heart, so they gravitate towards cardiac cases.
Makes sense. So if, say, our Sarah, she's thinking long-term, wants to specialize, how does that even work?
Well, experience is key, obviously. But also, those certifications we talked about, they're not just one and done. Got to stay up to date, especially as tech changes so fast.
Right, like those journals and conferences, all that stuff you send over.
Exactly. Keeps your skills sharp, shows employers you're serious.
Okay, so let's say Sarah's a few years in. She's got her eye on, I don't know, cardiac anesthesia.
Good choice. Always in demand.
What does she need to do to land that dream job? Besides, be amazing.
Well, first up, that interview. And thankfully, RoleCatcher's got you covered there.
Oh, yeah. What kind of questions are they going to throw at you for something that specific?
They're going to go deep, man. Cardiac anatomy, physiology, specific procedures. Imagine, how would you manage a patient's blood pressure during open heart? Stuff like that.
Yikes. That's next level.
Yeah.
So how do you even prepare for that?
Honestly, practice makes perfect. And RoleCatcher actually has this cool feature, right? You can practice answering common interview questions tailored to different specialties.
Whoa, it's like having a cheat code for your career.
Right. But also, it's not just what you say, it's how you say it. Confidence is huge.
Totally. Easier said than done when you're, sweating it out in the hot seat.
For sure. That's why prep is so key. Research the hospital, know your stuff, have some questions ready for them too. Shows you're thinking ahead.
Oh, I like that. Turn the tables a bit.
Exactly. Makes it more of a conversation, less of an interrogation.
Okay, so Sarah's got the skills, the experience. She nails the interview. What's next?
Show me the money. Salary negotiation time.
Ah, right. Always a bit awkward, isn't it?
Doesn't have to be. Knowledge is power, my friend. And guess what? RoleCatcher to the rescue again.
Okay, break it down for me. How does that work?
They have this whole salary insights section. Average, pay for your area, experience level, specialty.
So Sarah could see what a senior cardiac anesthetic technician in, Chicago makes.
Exactly. Gives you leverage, right? You know what you're worth. You can negotiate with confidence.
Smart. So it's about finding the right fit, not just the biggest paycheck.
100%. And that's not just about money, right? Benefits matter too.
True. Healthcare, paid time off, all that jazz.
Exactly. Got to look at the whole package.
Which brings us to, the elephant in the room. We've talked a lot about the technical stuff. But this job, it's got to be emotionally tough too, right? dealing with life or death situations. It's intense, right? Like, you're not just dealing with machines, you're dealing with people's lives.
It's a huge responsibility, no doubt, and you see a lot, especially in this field.
So how do you even begin to process that? Like, emotionally, how do you handle those tough days?
It's different for everyone, honestly. Some people, they need to talk it out, you know?
Yeah, like debrief with someone.
Exactly. Others, they need some solo time, maybe hit the gym, go for a run.
It's like finding what works for you, that outlet.
100%. Can't emphasize enough, self-care is not selfish in this line of work. It's essential.
Speaking of essential, you mentioned earlier, like, the team aspect. You're not in this alone.
Never. Surgeons, nurses, fellow anesthetic technicians, it's a team effort for sure.
What's that dynamic like in the OR when it's go time?
Communication is key, right?
Yeah.
Clear, calm, concise. Everyone has their role. Gotta trust each other.
I bet that takes time to build that kind of rapport.
Oh, yeah, for sure. Every surgeon is different. Every team has its own rhythm.
But when it clicks, when you're all in sync, that's got to be amazing.
The best. Nothing like it, honestly. When a surgery goes well, everyone comes out safe. That feeling. Man, that's why we do it.
I bet. So to wrap things up, for anyone listening who's, like, drawn to this world, healthcare, pressure, making a real difference, all that.
Anesthetic technician, it's a path, that's for sure.
And if you're ready to explore that path, RoleCatcher seems like the perfect place to start.
Agreed. Tons of resources no matter where you are in your journey.
Awesome. Well, on that note, I think we've done our deep dive for the day.
We covered a lot. From OR prep to salary negotiation, the whole 9 yards.
If you're still listening, congrats. You officially know way more about anesthetic technicians than you did before.
And hopefully you're as inspired by these folks as we are. It's a tough job, but man, is it ever rewarding.
Couldn't agree more. All right, everyone. That's a wrap from us. Until next time, stay curious.